Good afternoon, everyone, and thank you for inviting me here. And as I was saying earlier, I have actually learned a lot just by listening to what you all said this morning. So it was very helpful, and I'll explain some of that. Some of the questions that we did in the survey, I think I would have phrased differently and asked differently if I had known what I heard this morning. So, but just a little bit about the American Chronic Pain Association. We've been around for 39 years now. And our focus has always been on the person living with pain and to help them live a fuller, richer life in spite of pain by teaching them that patient education, teaching them, reaching out to them and their families with the self-management skills that they need to know, and also generate a lot of awareness around pain and pain management. But one of the things that when I was asked to give this talk, I decided that I don't really know what people think about the topical pain creams, and so we decided to do a survey. But before I go into the survey, I thought I'd give you a little background about what people are actually experiencing out there today, the people living with pain. And so they're taking opioids, and so a lot of it is around access to care. And so people today have a real hard time accessing any kind of care when it comes to pain care. If they're taking opioids, they're denied their care altogether. A lot of times if they're given an alternative treatment, a lot of times they're very expensive and the insurance isn't going to cover it. Even if they get PT, they may get 2 or 3 sessions, but they need a lot more than that. The interdisciplinary pain management program, something that I was really fortunate to go through 40 years ago. They're few and far between, if there's very many left, and they're really, really expensive. And then the lack of education, of provider education, I think is one of the biggest problems today in pain and pain management. And it goes back to losing those interdisciplinary pain programs and really training physicians in the modalities of pain management. There's a lot of stigma when you're living with pain. The validation, just being able to get that validation that your pain is real, is really important to people because they become very, very defensive if you don't believe their pain, and I'm sure many of you have seen that. We have a difficult time believing what we can't see. Pain's invisible. There's no way for us to know if pain is what they say it is, because you can't see a backache, a headache. Maybe if we took it out of our body and held it in our hand and say, look, this is how much I have. But we really have no idea how much pain they're really in. And because their behavior is on again, off again, very few people have 100% 10 all the time. We have good days and bad days. And so it's confusing for everyone around us, and it's also confusing for us because we're never sure. So we hear, we think maybe it's all in our head, we're imagining it, and then when the provider says, the treatment I gave you, especially when people have surgery, they'll say it was a success, then what do? What recourse do they have? But I think probably one of the biggest things, and I do a lot of work with the veterans, the VA, and so one of the things that you often hear is they see pain as a weakness, that if we should be stronger, we should be able to cope with our pain. And when it becomes so intense that it just consumes who you are, your thinking, your thoughts, it's really hard to do that. But we think of ourselves as very weak. So I'm going to get, I told Dan I was going to do this, but I have around stigma. Stigma, shaming, and shunning continues to befall patients with chronic pain, as do the inequities of access to care. And this was a quote that he had given to an article back in 2016 when he was president of the American Academy of Pain Management and Medicine, and I think that really sort of sums it all up. So where do they turn? We did another survey about 18 months ago of 1,000 people living with pain. So when they're denied care, they go to the streets. When they're denied the opioids, they do go to the streets. 56% of the 1,000 people that we surveyed have trouble obtaining their medications even when they have a prescription and take it to their pharmacy. They still have trouble. Heartbreakingly, 47%, almost half of the people that we surveyed, have considered ending the pain permanently. And we're hearing more and more of that today. A lot of suicides are happening. 88% of the people go to the internet to get their information. And as many of you know, there's some really good information on the internet, but there's a lot of really bad information. they believe everything they read. When they call us and they tell us what they've read on the internet, it's like, well, where did you get that information? I mean, we are really careful about the resources we give out, but the internet is out there for anyone. And then while 95% have tried some kind of topical cream or oil, only 6% have received that recommendation from their healthcare provider. So according to that survey of 1,000 people. So many people living, so we did the survey, and this is the results. Many people living with pain find it difficult to get relief. While there are many different therapies and treatments, we're interested in knowing if you use any type of topical skin cream as part of your pain treatment. So it was a very quick survey. We didn't have a lot of time. We got 469 responses. Totally complete were 406. So at some point, people stopped the survey. So we had 77% of them were female, 90% were Caucasian, 11%, and I rounded up the numbers, so it was probably 89.5 and 10.5 so 11% were represented minorities, 67% were married, and these are sort of the same demographics that we get from all of our surveys. 55% were college degree or higher, and they were distributed throughout the country. 66% had pain 10 years or more, and that's also typical for the kind of program or surveys that we do. 87% of them use some kind of skin cream, topical cream, to help manage their pain. The next one I typed wrong, and I apologize. 45% of them use prescription. Okay, so I fixed it there. I was looking at here. Use prescription topical creams as part of their overall pain treatment. 55% of them use an over-the-counter cream. And so a lot of these we ask type or check all that apply. So you'll get some, confusing, or you'll see that the numbers don't add up. 70% obtained from a retail pharmacy, while only 16% from a compounding pharmacy. Though what I found really interesting is only 14% of them didn't know if it was a compounding pharmacy or not. So it may have been a community pharmacy, or it may have been a compounding, and they honestly didn't know, nor do they know. And one of the things I would like to have asked is, the ingredients. Listening to all of you today, I would have liked to have listed those and have them check. My guess is most people would have said they don't know. It would have been, I don't know. I don't know that they read that stuff. But 64% of them do pay out of pocket, with 13% of them paying between $100 and $500 a month for their cream. And then we heard that too, that insurance doesn't cover a lot. So we asked, how long does it take for them to actually get relief once they rub it on their skin? Only 9% got immediate relief. The majority felt relief between 15 to 30 minutes. And 30% of them needed to reapply it every 4 to 6 hours. And the relief that they got only lasted 2 to 4 hours. And so that goes to another question this morning I would like to have known, and looking at those dispensers, do they put more than they should on it? You maybe only dispense once, but do they do it twice? That's the question, because if it's only lasting for 2 hours and they can only put it on 4, do they use double? And we see that a lot. And the amount of relief they get, 50% of them only get between 10 to 25% relief. Less than 1% of them got 100% relief from the pain cream, and 30% found between 20 to 25% by using, or 20 to 25% relief by using the topical pain cream.
Can I just have you go back and
Yeah.
ask a question about that?
Yeah.
So when you say 30% found between 25 and 50%, that's above and beyond the medicines that they're already on. Is that correct?
Yes. Yeah, we didn't ask them what else they were on. We did not ask that question. Yeah, like I said, I would have done this survey differently if I'd heard what I heard this morning. So when we ask about side effects, 89% of them reported no side effects whatsoever. However, 10% of them did report side effects. And of those 10%, 55%, most of them experienced burning and redness. But other side effects, and we asked them to check all that apply. So 33% got the itching, 33% got a rash, 14% got numbness, swelling, and then 10% of them experienced some kind of numbness where they put their skin cream. So we have a whole list of comments, and I did give them to Claire, so they have all those, and you have all the survey results too that you can share. But I just pulled out a couple of the comments, and one of them was around pets. If you have pets, you have to make sure that they're not going to lick the cream off, because that's a problem. Another person said, I can't think of going without my pain cream at all. They thought it was great. And somebody else said, it's not practical with arthritic hands because you're rubbing it on your hands, and you have to be careful either washing your hands or wash it off, or even rubbing your eye and forgetting that it's on your hands. As far as the prescription pain creams go, the use of Voltaren gel, which is not very effective, is my understanding that in other countries they can get ibuprofen cream, which appears to be much more effective. We need new and better alternatives to treat chronic pain conditions like mine. While someone else said I've nicknamed Voltaren the Wonder Gel. Lidocaine mixed creams seem to work best for this individual. Somebody else said it doesn't help with spasms. And then someone else said, nice for my psoriatic arthritis. So side effects, any capsaicin cream burns like crazy in the summer. We're in the South because if they sweat, it makes it burn more. It burns my fingers so badly that I can't use it on my hands. Another one says, I found the side effects of the topical pain cream, redness and swelling outweigh the benefits. A very short amount of relief for the pain, so I don't use the topical cream anymore. And someone else said it's pretty much worthless. And when it gets hot and humid, meaning I'm assuming in the South and DC, because it's hot and humid out there, it's totally worthless, and it runs and it melts. So I'm not sure. Again, it goes back to how much are they actually using for it to be running and melting versus actually rubbing it into their skin. Side effects, the redness depends on how frequently I need it, either using it daily or versus once a day or versus all day long. And then compound creams I tried still cause allergic reactions like the side effects of the oral medications. And the doctor told them that it wouldn't create any side effects whatsoever for them. The cost, and this is something that is always a concern for people. I use the cream on my knee and other sore joints. I was on a compound cream, but insurance quit paying for it, and I could not afford it on the monthly cost of that cream. And most of the prescription medications were not covered by my insurance. The cream was very helpful while I was able to get it, but my insurance company stopped covering on all compound creams. I used lidocaine, but insurance stopped paying for it after 4 years. So they used it for 4 years, saying it was only for people with postherpetic neuralgia. Again, the cost, I used the compound cream, which worked better, but I can't afford it because insurance won't pay. Another one I have also tried and used CBD oil and cream salve, and that's effective, but the costs are higher. All right, let's try that one again. But the cost is high like the compound creams, so it's just as expensive as the compound creams. I use a lidocaine 5% patch, but Medicare won't cover that. So using topical creams such as compounding creams that I pay more than $250 every 3 weeks to use to help me avoid using narcotic pain medications. And because I have a complication of irritable bowel syndrome, constipation, taking pain medication is not really an option for me. Plus my compounding cream provides better relief in an area where I have pain than the narcotic pain medication. So the amount of time of relief they get from the pain cream, most of the time pain creams don't work. It gives you maybe an hour or lower of pain control. None of the OTC options are long-lasting or effective. My acupuncturist started using it on me, and I immediately saw relief from the pain. So I don't know whether it was the acupuncture that did it or the pain cream that did it, or if it was before or after. They didn't get into all of that. I started using a topical medical marijuana pain cream, and it's amazing. It lasts long, it takes away more pain, and it's cheaper. When it comes to access to these pain creams, helped change the law for Vicuprofen, I don't know what that is. I took it for 18 months correctly with no abuse. I respect the laws, and I'm suffering right now, so they must have not been able to get it. My doctor recommended that I try CBO. It works better than compounded stuff from pharmacies. These are direct quotes from these people. I tried a compound cream which works wonders and lasts for a while, but my pain management office refuses to write the prescription for the compound, so I get stuck with only a 4% lidocaine cream. I live in Mexico where my medicines are available without doctor's prescriptions. I can buy over-the-counter several preparations that are prescription only in the United States. And then sort of to go to that is use Voltaren, 1%, $60 with insurance. I cannot buy 2% with insurance in the United States. However, they can buy Voltaren 2% over the counter in Mexico for $12. So it gives you a little, so that's sort of the overview. And again, thank you very much. That is our webpage. We have a wealth of patient education materials, graphical tools to help communicate, and other things on our webpage. So thank you.